What is it about this outbreak? I mean, you write in your column that they were expecting an outbreak, but not this one. Why not this strain, and why not at this time? Why is this so dangerous?
Really, it's because of the fact that this is actually a rare strain of Ebola. Bundibugyo has only turned up twice that we know of since 2007. Both times, the cumulative number of cases was fewer than 200. So experts were predicting the next Ebola outbreak would more likely be the Zaire strain that caused the devastating outbreak in West Africa just over a decade ago. And so this one wasn't on anyone's radar.
I want to ask you, you quote Dr. Craig Spencer in your piece, and those of us who've lived in New York for a while remember when he, a doctor who was based here, came back from Africa carrying Ebola and the kind of fracas that caused here in the city. I remember there was a bowling alley in Brooklyn that closed down. There was a lot of agita just surrounding him being here and having a positive case here in the United States. He now is at Brown University continuing to study this disease. What did he say about the response to this one compared to what we saw back in 2014 and 2016? How are the circumstances surrounding this one different, both in terms of the epidemiological side of things and also just the public health response?
Yeah, so we know that with this particular strain, Bundibugyo, there is no approved treatment or vaccine. So unlike Zaire, that the world had been sort of practicing in countering with vaccines and monoclonal antibody therapies, here we have nothing like that. We're going back to where we were in 2014, just with supportive care. So from that perspective, it's kind of really devastating. But also because many of the mechanisms that we had in place to try to arrest these outbreaks quickly, to get on top of them, have been kind of wound back through aid cuts, for example, cuts to the CDC, research being pared back at the NIH. So on that level too, it's also very disappointing.
Yeah, you have another quote from Dr. Spencer about that exact thing in your piece, saying, the deeper frustration is the sense that the world keeps repeating the same cycle of panic and neglect. We've put together, torn down the infrastructure that we need to do all this in the span of a decade. Talk to us about how big of a deal it is there's been a lot of cuts across the board globally to NGOs, but especially the dissolution of USAID and what kind of a difference that made, even if it's not medical personnel, just eyes on the ground, logistics, people in villages noticing things that they can report back, like really basic things are not happening.
Yeah, exactly. Contact tracing, that's, finding out all of the people that infected people were in contact with, and then checking them, testing them, isolating them, making sure that they aren't infected and then spreading it on. That work was largely done by USAID officials. And of course, that organization is no longer running. So there is a big hole there. The US is, of course, withdrawn from the World Health Organization. So this UN body has lost its biggest donor and has had to pare back on a lot of its programs around the world. So we're seeing this all sort of coming to roost.
Jason, last question here is just about the U.S.'s response. And my inbox this week has been flooded with emails from the State Department emphasizing all that the U.S. government is doing, noting that the CDC is kind of running point here. And I kind of catalog here what the CDC has said, that the public health screenings for those arriving from areas affected by Ebola here in the U.S., they're coordinating with airlines, they're enhancing port protection, deploying CDC personnel for outbreak containment, really emphasizing the fact that their goal here is not to have any Ebola cases here in the United States. How do you assess the work that the U.S. government is doing? Again, drawing that contrast back to 2014, 2016, how radically different is it?
Well, for one thing, Tom Frieden, when he was the CDC director back 10 years ago, Ebola in West Africa was a full-time job for him, I'm told. At the moment in the CDC, we have a part-time director. So, I think that's pretty telling. There are so many parts of the U.S. Health and Human Services bureaucracy that are missing. There's no Surgeon General. There's no FDA commissioner. Like, if you go through the list, there are a lot of pieces missing. And while sure, the State Department is saying that they've got all people on the ground, reporting, I think, by the New York Times, is suggesting that many of those jobs that are ostensibly, on the ground in Uganda, in DRC, are actually vacant.
Yeah.
Jason, appreciate the time, especially on Saturday night for you down there in Australia. Very grateful for that. That's Jason Gale, author of the book After COVID, The Health Impacts That Will Last Generations, a medical and science editor for us here at Bloomberg News. Be sure to read Jason's weekend essay right now at Bloomberg.com.